My Health Matters is a flagship initiative of Global Health and Community Services, Inc. This monthly one-hour forum aims to educate and inspire communities across the globe. My Health Matters provides culturally relevant health information, resources, and tools to get the best quality health care, access to some of the top health experts. Each episode will highlight the healthcare issues that disproportionately affect many communities, while also providing action steps to help us heal. My Health Matters.
Hello, my name is Dr. Lewis Hines, and I am the chairman of the Medical and Health Committee within the Florida statewide organization of the Omega Psi Phi fraternity. I'd like to add a disclaimer. This webinar is being recorded. At this time, I want to acknowledge our sponsors for the webinar: Global Health Community Service, Inc., Florida statewide organization of Omega Psi Phi, our platinum sponsor, Quantum Foundation, the TED Center, Healthier Boynton Beach, Non-for-Profit First, Truett, Alpha Upsilon Omega chapter of Alpha Kappa Alpha Sorority Incorporated of Wellington, Florida, Epsilon Gamma Omega chapter of Alpha Kappa Alpha Sorority Incorporated of Huntsville, Alabama, KOP Mentoring Network, who was producing this production for this event. For the audience, if you have any questions, please text your questions at 516-600-2576. 516-600-2576. Now, for the greeting, it is my honor to introduce the leader of the Florida statewide organization of the Omega Psi Phi fraternity, our state representative, Brother Darren Toaster.
Good afternoon. On behalf of our Grand Bosselist, Brother Dr. David Marion, our 7th District Representative, Brother Reginald Harris, and all the brothers in the Florida statewide organization, my name is Darren Toaster, and I am the 7th District's Florida statewide organization state representative, and I want to welcome everyone to today's discussion on mental health. Thank you to our panelists this afternoon for participating in this webinar and bringing your expertise to today's discussion. Thank you to our Medical and Health Initiatives Committee, and thank you to our partners and partner in this endeavor, Global Health and Community Services, Inc., as well as our sponsors. When speaking about mental health, we realize that this is a topic that is wide-ranging, from dealing with depression, anxiety, or abuse to dealing with the loss of a loved one. This is a topic that touches all of us, both young and old. I look forward to today's discussion and thank all of our guests that have logged in today to participate. Thank you.
Brother Toaster. Now it is my honor to introduce the president of Global Health and Community Service, Brother Purcell Pratt.
Thank you, and good evening, everybody. Good afternoon. I'd like to take the opportunity on behalf of Global Health and Community Service, Inc., along with our partners, the state organization of Omega Psi Phi, bringing this webinar to you pertaining to mental health and other issues pertaining to those activities. Please enjoy yourself, have fun, think about the things that you need or should do throughout your lifetime and your family. Watch your shoulder, stand tall, understand what's right and what's wrong. Take this opportunity to gather information for what we're about to share to you from professional doctors that are going to come to you this afternoon and tell you a little bit about what mental health is all about and some of the things that can guide you in a direction to deal with your local physicians and Hey, enjoy yourself and be safe out there.
Thank you, Brother Pratt. Next, it's my pleasure to introduce Miss Global Jamaica Pitquina Burrow. She's going to give the welcome. Thank you, Brother Pratt.
Good afternoon. It's an absolute pleasure for me to be here offering these few words of introduction. My name is Pequina Burrell, and I am one of only 5 young women who recently selected to represent our country in international competitions of intellectual agility, wit, grace, and beauty. In a few days from now, I will travel to Bali, Indonesia, where I will wear the sash of Jamaica at the Miss Global International 2022 competition. Today, however, we are all gathered here to explore the many facets of mental wellness. During this course of our normal lives, every one of us will experience the pressures of work, school, traffic on the roadways, lines at the supermarket, not even to mention the many stresses that comes from parenting, or even all that it takes to manage the ups and downs of building relationships with our friends, family, and coworkers. So the simple question is, how do we cope? Well, the organizers of today's webinar have designed a wonderful program called Mental Health Awareness, Adults and Youth. Experts in the field of mental health counseling and therapy will help us navigate. By the end of our talk, we'll leave with a broader understanding of how to select a mental health counselor, how to cope with the loss of a valuable family member or a friend, how to help children with peer pressure, and how to identify the signs of mental health crisis and what to do if we see the signs. Finally, we leave with a better understanding of how to prevent ourselves from falling into deep depressive states, especially due to the feelings of loneliness and how to cope with the feelings of inadequacy or insecurity. Thanks again for joining us today. We truly appreciate your attendance. Welcome, welcome, and welcome. Thank you.
Thank you, Ms. Burrows. Now for our esteemed panelists, I'd like to introduce a team of mental health experts that I believe that we will get a vast knowledge of information. First of all, I'd like to introduce Dr. Deidre Sanders Burnett. Dr. Sanders Burnett is a licensed mental health counselor, qualified supervisor for registered mental health counselor, adjunct instructor for the University of South Florida, Florida Supreme Court family mediator. She is also a certified professional counselor, certified teacher. Dr. Sandra Burnett earned her doctorate of philosophy and counselor education with a coordinate in psychology, a master's of arts degree in Pacific Learning Disability, and a master's of arts degree in guidance and counseling. She is the proud graduate of with a bachelor's degree from Bethune-Cookman University. Dr. Sandra Burnett has taught in and provided mental health counseling in K through 12 public schools, college, universities, and in her private practice in Florida for the past 38 years. Dr. Sandra Burnett is also a published author whose dissertation is in 20 countries. In addition, she has been published in Session magazine. Dr. Sandra Burnett is a member of multiple professional counseling organizations, in which includes the Florida Mental Health Counseling Association as the past president. And she is also a member of Zeta Phi Beta Sorority Incorporated, a Gamma Pi Zeta chapter. Dr. Deidre Sandra Burnett. Next on our panel, I would like to introduce is Rod Cunningham. Rod Cunningham is an author, life coach, speaker, CEO, of Chief Empowerment Network. He's retired from the Air Force after 29 years of service to our country. He has counseled and mentored over 15,000 military personnel. He's a former program director of DEA, educating over 20,000 youth and family of the dangers of opioids and its relations to mental health. He's a former president of Pinellas County Urban League. He's a former school board member. He's a former U.S. Congressman of Charlie Crist Military Selection Team for West Point. He has authored 2 workbooks on mental health and emotional awareness, and he is also a member of the Omega Psi Phi fraternity and 500 Black Men of Tampa Bay. Next on the panel, I would like to introduce the esteemed Dr. Beverly Smith. Dr. Smith has professional experiences, counseling experience in a variety of settings, including mental health, private practice, public education, corrections, community counseling, higher education. She is the owner and principal psychotherapist for B. Smith Consulting Group, LLC. She is an adjunct professor of clinical mental health counseling at Mercer University, where she teaches psychopathology and diagnosis, cultural perspective in counseling, and ethics. She is a proud 2-time graduate of Tuskegee University with a bachelor's degree in biology and a master's of education and counseling. She has earned a counseling degree also from Troy University, an educational specialist, as well as Ambridge University, where she has earned a PhD. Dr. Smith also has certification in administration and leadership from Kennesaw State University. With 26 years and more of years of experience, Dr. Beverly Smith has served on several counseling professionals, and she is an active member of various professional associations. Dr. Smith is a national and international presenter for various organizations. She has also been a peer reviewer for proposal for the 29th, 30th, and 32nd National Youth Advocacy and Resilient Conference, as well as the 21st National Conference of Child Abuse and Neglect. Dr. Smith sits on many boards. In 2020, Dr. Smith was elected as the trainer leader for the United Methodist Women of North Georgia on topics related to living in an anxious world, managing anxiety and managing emotional, relating diversity and advocacy for change during the COVID-19. She is the spiritual growth coordinator for the entire North Florida Conference of the United Methodist Women. The conference that consists of approximately 12 districts, 800 clergymen, and 360,000 laymen. Dr. Smith is a licensed professional counselor in the state of Georgia. She's a master addiction specialist and board certified coach. She is also a member of Delta Sigma Theta Sorority Incorporated. Welcome, Dr. Smith. And we also have on our panel Stephanie Brinkley Wellings. Stephanie Wellings is currently the lead mental wellness therapist and community health advocate for the school-based mental wellness program for Putnam County School District in Palatka, Florida. In her role, Ms. Wellings is responsible for coordinating behavioral health services for students referred for mental health and prevention services. Ms. Wellings is a licensed mental health counselor and the owner of Brinkwell Therapy and Counseling LLC. In her role, she provides psychotherapy, telehealth, individual, family, and or group individuals and group counseling to those presenting various emotional, social, and mental health needs. She provides services along with parenting, education, and anger management classes in her practice. Ms. Wellings is the owner of Misty Twisty Knots, a registered trademark in Misty Twisty Knots book series, Understanding Emotions, Behavior Associated with Anxiety, and The Thinking Cap, The Power of Your Thoughts. In this capacity, Ms. Wellings facilitates reading out loud and training in small groups and large group settings to provide education on topics related to emotional health and wellness. Ms. Welling has earned a master's degree in mental health counseling from the University of North Florida and currently pursuing a PhD in general psychology with an emphasis in industrial and organizational leadership. She's completed her undergraduate studies at Bethune-Cookman Universities. Ms. Welling holds various certifications. She's also serves in the following capacity in terms of mentoring, curriculum development, and the founder of ROC, Rescuing Our Communities with Knowledge. Ms. Welling is a member of Delta Sigma Theta Sorority Incorporated. Welcome, Ms. Welling.
Thank you.
Okay, I'm tired just going through the introduction. Okay, let's get started. I saw a statistic saying the other day, a couple of years ago, that 13.4% of all of the U.S. population identifying themselves as Black and African American, and out of those 13.4%, over 16% reported having mental illness in 2018. In 2020, during the pandemic of COVID, unemployment, increase in stress and anxiety levels, depression, divorce rate has increased, has doubled, suicide has increased, witnessing of brutal police killings, economic stress, isolation, increased panic disorders. People were lonely before the pandemic, and now during the pandemic, they were told to isolate. How has all of this affect our mental health? And that is a general question to anyone that wants to answer on the panel. How had all of that we have gone through during the pandemic and now probably a post-pandemic, how do you think mental health has people have been affected by their mental health?
Good afternoon, everyone. My name is Dr. Beverly Smith. Dr. Hines, thank you for allowing me to be a panelist. I do appreciate the opportunity. This past year, I've served as president of the American Mental Health Counselor Association, and I'm a licensed professional counselor in Georgia, a licensed therapist. And a few of the things that I've seen this past year, in the past couple years during the pandemic, is that individuals begin to struggle with their mental health. We as a community experience collective grief. We experience collective trauma. We had collective mourning in our communities. In fact, individuals were really just at a point of, I've had enough. And sometimes when we have enough, our minds and our bodies begin to kind of disassociate and shut down. And for some, that is a protective measure. So I would say overall, we experience grief for many of us individually. But we also experience corporate grief, corporate mourning as well. And that had a significant impact on our thoughts, our feelings, and how we behave, as well as how we interact with each other.
Thank you. Anyone else on the panel would like to chime in on that?
Good afternoon. I'm Dr. Deidre Sanders Burnett, and I commend the Global Health and Community Service, as well as Omega Psi Corporation, for having this vital conversation and discussing with our audience how our mental health has been impacted, and being able to empower our audience on how to care for themselves as well as their loved one. Yes, Dr. Hines, you definitely talked about some of the risk factors, the global risk factors that it has increased the prevalence of mental health within our community, within our society. These risk factors have impacted us in various ways. We've had collective loss, collective stressors, an increase in domestic violence, an increase in loss of loved ones, loss of jobs, some uncertainties. This has impacted our social, emotional, our cognitive abilities to relate well with others within our society, and to cope with those compounded stressors that continue to manifest themselves throughout our society.
Thank you. And since we're talking about mental health, what is mental health? What is mental health?
I think all of us have mental health.
Yes.
All of us have mental health, and we're just at different places on the continuum. For some of us, we may need more support than others. And for some, we may need less support. But it may all depend upon the season of our lives, or again, what's going on in the world. For example, COVID-19 was an impactful global pandemic. And so with being in a global pandemic, all of us experience mental health each and every day, with or without the pandemic. But some of us maybe was on that continuum of needing a little more support due to the stressors and trauma that we were experiencing.
Yes, and mental health, I agree, Dr. Smith. Everyone has mental health, and it is a state of well-being. It is a state where each one of us are able to identify our abilities and to cope with the normal stressors in life, the ability to work productively and to be fruitful and to contribute to our community and our society.
Right. So again, if I was a person just listening to this webinar, and I'm thinking that would I need at some point in time to check to see if my mental health is well or not well, how would I go about seeking mental health counseling?
There
One
are.
thing that we might want. Go ahead.
Go ahead, please. Go ahead.
Yes. One thing that you want to do is you want to look at, how do you handle the milder symptoms and compare that to what's disproportionate within your range of functioning and coping. You would want to look at if you are experiencing some significant dysfunctions in your ability to think, your emotions, your regulations of your emotions, your behaviors, any disruptions that you have in your daily life activities that may be prolonged and significant for you, as well as duress and stress. You may want to look at how you relate to your in relationships with other people, as well as engaging in daily activities that are normally satisfying to you. So you focus on your cognitive thinking, your emotional well-being, your social relationships, and your overall functioning physically and emotionally.
All right. Ms. Wellen, you had something to say about that.
Yes. I think a good vantage point to start is to be very self-evaluative. When individuals are inquiring of how you are, and how you've been lately, I've noticed something different about you. I think that's an opportunity. That's a key indicator for us to consider that something may be different about us. So with saying all of that, it is important that we have a level of awareness and that we become mindful of how we think and how we feel in those moments, and pay a very close attention to what's really going on with us. I think self-evaluation, being educated about mental health and mental illness, which are two different opposites of the spectrum. I think that's important. So really getting to know yourself, knowing when you're good and when you're not so good, and paying attention to others who notice something different about you.
I like that thought, because even if I know that I may not be feeling well and I may not be in the best of mood, I may find myself down, but the problem that I may have is that will people think I'm crazy? Will they think that I may be losing it? Will I, when people think that I'm kind of, so there's this stigma about mental health. Particularly, in America cross, but particularly in Black America. And so how do I get past the stigma about, I'm not crazy, but I'm not feeling myself?
You mind if I jump in on that one?
Go ahead, Rod.
Oh, thank you so much, Dr. Hines, for inviting me on this call. When we talk about culturally speaking with mental health, I believe that there's two reasons why African Americans avoid going to therapy. Number one is because what grandma said, she said, what goes on in the house stays in the house. Right? We can always answer. Everybody out in the Black community, when I mention that, everybody can finish that sentence. And so we have this sense of everything's a secret. What happened in the house, we must keep it. So we grow up with that shut your mouth. So we've been shutting our mouth for 200-300 years. And so that's one reason why we don't come forward. The second reason is society has said that something is wrong with us because of the color of our skin. And now you're going to tell me something else is wrong with me? I reject that. Sorry, I'm not crazy. I'm not going to counseling. So I would say those are the two main reasons why we feel that.
Okay. I got a question here, and from person Corey. He says that I feel that in a way that we market the pros and cons of going to mental health counseling. And so I think that, and that's a good question or statement, is that if you don't go and seek help, I don't care whether it's a mental health counselor or a pastor or talking to someone, there will be some consequences. I think that, and I've been quoted on this, that I think that everyone should check in with a mental health counselor or a therapist, just like you check in with your physical physician for your medical health. And so if I get past this stigma, what do I encounter when I first meet you guys? What do I expect when I walk into a mental health counseling office?
One of the things that I want my clients and patients to expect and to experience when they come to see me for help and for support, and that is to feel as if I care. I have an interest in him, her, he, she, or they getting well, getting better, improving their quality of life. When they experience a counselor or engage with a counselor, they should expect confidentiality. They should expect transparency. They should expect also their therapist to answer questions that they may have. There are some individuals who may value spirituality or religious perspectives from their therapist. There are some that want a therapist who's a male, who's a female. And so when they encounter me or when they encounter a counselor or therapist, they should expect transparency. They should expect that individual to be confidential, to be forthright, and to provide the service that they're contracted to provide, but also engage them in the process of determining what is the treatment plan. How will we arrive at the goal that we want to arrive to? How many sessions would it take? And I tell individuals, when you are looking for a therapist, it's just like when you're looking for a physician. You go in, you ask questions, you interview in a discreet and indiscreet way. And if it's not a good fit, then you look for another provider. But look for a provider who will meet your needs, someone who you feel comfortable with in asking your questions and being who you are and putting all of your concerns and issues on the table.
Thank you.
I'd like to go ahead.
Go ahead, Ms. Welling.
I'd just like to add to that therapy works best when someone is willing to seek support and willing to be professionally guided. Therapy is a safe place. It is the one place where an individual who may not have had a choice, who may not have a voice, is able to speak vociferously for themselves. It is their place. They should own it, and they should feel safe, and that they should know that they are safe and free to share some of the most their secrets or their challenges, and without being judged or criticized. I think therapy is, and I'm advocating right now because we are in a state of public health crisis, and I want individuals, if you're listening, just to know that you are safe with us at any point, regardless of the color of our skin. You are very safe with us. We're trained and we're professional. We didn't invest this much time in such callings as such just to show up and not, I say, show out.
I want to agree with what you said, is that our goal is to create that safe space, not only to create that safe space, but also to hold out hope when the individual is experiencing despair, or the family or the couple. Our role is to hold out hope while that person is in despair as well.
And if I could piggyback on that, as a life coach, the difference between me and the doctors here, the therapists here on the line, is that they help you deal with your past while I helped you craft a better future. So my coaching clients actually have therapists. And so one of the things that they can expect from me is just like what the doctors are saying here, is transparency. My clients tell me things that they haven't told anyone, and I never act surprised. There's nothing that they can tell me that will surprise me, and I think sometimes they even test me, right? They put some heavy things out there, and I go, okay. And so now they're finally like, okay, I've tried him with this, or let me give him something else. Let me give him something else. And next thing you know, they are totally open. I haven't reported back to their parents who pays me, right, to coach them. I haven't reported anything back. They haven't heard anything. So they continue to be very open. And when they're having panic attacks, they call me outside of our sessions. When they are going through something, they call me outside of the sessions, and I'm able to help walk them through, calm them down throughout. So those are the things that you can expect from a therapist as well as a life coach.
And
also, I'd like to say that just giving that client hope that they are not in this alone. They are with a clinical trained expert professional that is there to educate them, to give them techniques, skills, to help address their problems that they are dealing with, whether it be past, present, and then to help them for plans for their future, to improve their well-being, their mental well-being. And also to know that this information is confidential. They have a right to confidentiality. There are exclusionaries to confidentiality, but we are there to protect them and to help them heal. As well as if we decide that we are not the expert in that particular area, we will do referrals to other clinicians that can that have expertise in those areas.
One of the things, Dr. Hines, I want to add, one of the things that we do as a licensed clinical clinician in the state in which we reside and provide the services is that we help individuals process through what they've experienced and what they're going through. And that's one of the cornerstone of our services, that we're able to process with them within an ethical and legal manner. And that's critical and that's important, because oftentimes we do not seek out that necessary help so that we can process through, unpack those things that we've experienced in our past, from family of origin, from current families. And so if we don't process through those things and allow someone to objectively be there and help us make sense of it, then we continue to carry those burdens, cry at night alone by ourselves, and we carry that heavy weight through life, which impacts us and our very being and how we operate and the lenses that we look through every day. I liked earlier that we talked about the impact of culture. And I think culture is very important because it affects the lenses that we look through each and every day. And unfortunately, in our culture, we still experience a lot of stigmas when it comes to mental health. It's nothing wrong with incorporating spirituality. I incorporate in my practice, my service, and who I am. But at the same time, I feel like we have more tools than prayer. Prayer is extremely important and we should utilize that. But that is one of the tools that we've been given. And so connecting with other people, helping other people, licensed individuals, helping us to help individuals to walk through their stuff is important to help remove stigmas, to helping us have a more improved quality of life as a culture of people. And we still have to talk about the impact of culture on seeking mental health.
And one thing we didn't mention is that most of us have therapists as well. Counselors need counseling. when I go through, I lost a good friend of mine 3 months ago. I lost him on Monday night. On Tuesday morning, I was calling the VA saying, hey, I need to talk to my therapist. Mm-hmm. And so I don't play around with my mental health because I'm expected to perform at a certain level, to have a very high frequency. And when my frequency is low, I need some help getting it back up.
And that's why, we work with our clients, we work with our colleagues, we help each other because we're all in a community. We're all a family, if you will. But in our community, we talk about self-care, the importance of self-care, and what is it? Oftentimes now, I think we use that self-care word a little lightly, and we think it means going to the nail salon or going to the beach or shopping or things of that nature. But it's much more than that. Self-care is about what is the routine. What do you have in place to help you keep moving forward and to help those around you move forward?
Fantastic. And Dr. Smith, I totally agree with that. And what all the panelists have said, that stigma is real and as a barrier to accessing and to making yourself available for mental health services. There's structural discrimination that is prevalent. That's one that may seek mental health counseling. Society may look at that as a weakness, but it's actually a strength. There's some stigma that has carried over from the Middle Ages, is that, mental health is a weakness, that a person with a mental health illness is dangerous, is unpredictable, unreliable. Some other stigma is that it may be some type of punishment. So as we try to reduce that stigma, one thing that you all are doing today is that you're making yourself available and present to share and exchange information that you can implement yourself as well as share with other people.
I'd like to add just one tidbit. May is Mental Health Awareness Month, and I so happily wear a shirt that says on the front of it, don't talk about what you don't know about. Mm-hmm. So I'm so appreciative of this format and this platform because oftentimes fear, misunderstanding, and those disparities, the stigmas that do, as Dr. Sanders stated, stigma produces barriers to treatment. And so those types of stigmas, folks just not being knowledgeable of what mental health is, the difference between mental health is great to have it, and the difference between mental health and mental illness. So we should not discuss what we don't know about. We should get that information and come to the experts and garner such information. Thank you.
Well, I like the responses. I want to go back to confidentiality. Are there levels of confidentiality that are in place? Can I tell you anything and everything and it won't leave your office? Or if I tell you something that may be detrimental to my health or someone else's welfare, are you still going to keep my secrets?
Interesting. I mentioned earlier about you can expect confidentiality from your therapist. You can expect it when you're working with me. And that is real. You do have confidentiality, but there are certain parameters around that. If you are threatened to hurt or harm yourself or someone else, then within those boundaries, then I have the legal and ethical duty and responsibility to inform the necessary individual personnel so that you can get the necessary help or support that you may need. And so we do exercise confidentiality, but if you're going to hurt and harm yourself, then we have the legal right to get you the necessary help by notifying individuals. Like if I'm seeing an individual who's a minor, I always tell them what we talk about is confidential. However, if you tell me you're going to hurt or harm yourself, then I have to make sure I get you the necessary help. And the same applies for an adult. The same applies for an adult that I'm working with.
So I would refer to my go-to for that is there are limits to confidentiality. And one of the things that for our listeners if you have questions regarding confidentiality, to make it plain and clear, we are nurturers, we care as therapists, as counselors, we have compassion, we walk in this arena because we do care about people and we're concerned. But I often explain it in this way: confidentiality. You're an extension of yourself. Beyond these four walls, you still live, you exist, and there are things that may affect you. So with that in mind, there are only things that I can do for you. So I have to borrow and from others who can help you, such as if you're in need of food, if there's neglect of a child, I'll tell that child, in those situations, I can't go to the grocery store. I can't transport you home. So in those situations, what I will do is reach out to someone who can do something different than I do, but at the same time, help you as well.
Thank you. Thank you. Let's talk about, I come in, I'm fine. Okay. I have to make sure that I'm honest with you guys. I'm telling you things. Who determines if medication is needed?
As a licensed professional counselor, a licensed psychotherapy, I do not administer medication, but I do work with an integrative team, an integrative healthcare team, an integrative disciplinary team, in which you may have various individuals who sit on that team, someone who provide the actual psychotherapy and someone to do med management or to dispense the medication. And generally you have a psychiatrist who will administer medication. And then I'll help the individual process through what they're dealing with so that eventually that they can wean off the medication. For some, they may be on medication longer than others. For some, they may just be on medication for an extended period of time. But one of the treatment goals that I like to discuss with my clients and patients is, would you like to wean off a medication? If that's the case, then that's one of the goals. And we work towards that in processing and helping individual to kind of unpack their stuff.
Dr. Smith, you mentioned about a psychiatrist. A lot of our listening audience really don't know the difference between a psychiatrist or psychologist and a psychotherapist.
Mm-hmm. Well, a psychiatrist is one who will have an MD, and again, they will dispense medication, prescribe medication. Some engage in talk therapy, but for the most part, they are the individuals who will provide the prescription for the medication. You have psychologists who will also provide counseling sessions and so forth, and they provide evaluations as an assessment, as well as you have myself, who's a therapist, psychotherapist. I do assessments as well, do diagnosis, as well as provide the treatment. So there are some things that may overlap with the individual. I would say to everyone, if you are seeking help from a therapist, ask them for their credentials, ask them to explain to you what is their scope of practice, what do they do? And it's okay to look them up in the state registry, Google their names to see who they are and the services that they provide, and to ask them again to explain their services and what to expect.
I have had clients to actually use a consultation that I provide for free to check me out. Ask me about my credentials, ask me about what school I attended, what training, how many years. And so it's quite normal for a person to have a free consultation session, and ask all of the pertinent information, see if there is a good fit between you and your therapist.
Mm-hmm. And I'm glad you mentioned that, because I've done that in the past as well. I don't give the whole full hour of consultation, but I'll give 15 to 30 minutes of consultation, because it's important for everyone to feel that it's a good fit and that no harm is given or administered to anyone, not by accident, consciously or subconsciously.
And I would recommend that if you decide that this psychotherapist is not a good fit, don't stop there. Just go ask for other additional referrals and go seek another psychotherapist.
Mm-hmm. Dr. Sanders, that's a very good point, because I usually tell my clients is that, creating or entering into a therapeutic relationship with a therapist, almost like dating. Don't go by the first date. Give them another shot at it and see if it may work out. I have a question. If a person chooses to enter into therapy, can their employer find out or get any type of records that they are in therapy?
Actually, that confidentiality belongs to the client. It is the client to decide whether they share information with someone else. And that would have to be a written release of information to share that information with the employer. The employer cannot insist on that person disclosing that information and does not have access to gather that information without the written consent of the client.
I have a question
go
ahead. I'm sorry.
Most organizations, most employers have an EAP program, Employee Assistance Program, in which you can call, and it's normally in the HR department, and when you can get services of support, counseling, coaching from within your organization. You can also call, if you have insurance, you can call your insurance company and ask for the behavioral health department and ask for a referral. But if you're seeing your employee assistance program with your employer, that should be a confidential place to seek services. And if you do not want to seek services with your employer or call your insurance, then you can simply, do your own research. Look up Psychology Today, type in your state or your area, and it'll give you a list of individuals who are licensed in the area who provide services as well as their expertise.
I'd also like to just add just a tidbit on that. You're really not required. You don't have to access your HR department. I've learned that recently as an EAP provider. If you pay attention to your employee handbook, sometimes it lists that. So that even reduces the discomfort in even having to ask for an employee, an EAP referral. So that information is contained in your company handbook or your employee handbook, so to speak. So you don't even have to go and ask them.
Another approach to that would be to, if you had to go through HR, just say, I'm looking for my child. Looking for I want to use EAP for my child. That doesn't mean you didn't later on decide that you're going to use it for yourself. So that's another way to avoid that.
And let me just add this real quickly. I'm sorry, this is great, but let me just add, we're just kind of a wealth of knowledge here, and that's cool. But there are so many benefits under the umbrella of your employee assistance program. Mm-hmm. Yeah, take advantage of that. I mean, legal assistance, daycare, even for automobile repair. And it's no charge to you. Your sessions are actually free. They're limited, but they're free at no charge.
Mm-hmm. Okay. I have a question in the chat that said, what is the average cost for therapy?
Now, I would say, again, if you're accessing the EAP, because I'm a provider as well, you generally will get the first 3 sessions. They'll give you free. Your employer will not know the content or anything of that nature of the session, but you'll get 3. There have been times I do send back to the insurance company that I am seeing this individual, and I always let the individual know what I'm putting on the form. But it may depend upon the area that you're in as far as the cost of services. There are sometimes I will have a sliding scale for those who actually need help and support and do not have the funds. And there are times that, those who can really pay the fee. And so for some individuals, they may charge anywhere from $100, $175 to $200 to $250 an hour. It just depends upon what is happening. If you're doing counseling, it's one fee. If you're doing an assessment to determine diagnosis and things of that nature, the price can be a little more at the beginning of the session. And then there are some that if I'm just doing the coaching, it may be a lower fee or price that I may utilize.
And it is not a one size fit all. Like Dr. Smith says, it depends on the type of services that you're receiving, whether you're receiving individual counseling, couples counseling, marriage counseling, group therapy. It depends on if you are seeing a therapist that is accepting insurance, or if there is a therapist that is only fee for service. Depends on the location that you reside in. So it depends on the insurance that you have. So it just varies. That's something that the therapist, if you're going through a psychotherapist, they will disclose prior to your first session as far as how much you anticipate paying for that first session. And then after you go in and you receive a assessment, diagnosis, they will give you an estimate, a good faith estimate of the rest of the remainder of the sessions and how much that will cost you.
And I'm glad
I
that you
can
mentioned
talk about the coaching piece as well.
Mhm.
The cost for coaching is normally paid by the month. And so, for instance, my services is $1,000 per month, and my clients are normally with me anywhere between 7 to 12 months. And so, for the coaching piece, and we don't accept insurance either. And so, just to kind of understand that piece as well.
You do have self-pay options. You do have self-pay options.
Yep. We do have the self-pay option. I want to add something that Dr. Sanders Burnett mentions is really important, which is called good faith estimate. Nationwide, we are all required, all those who are licensed are required to provide a good faith estimate prior to services that are rendered so that there are no surprises.
Yes.
And so you will find out when you go to see your physician, with any healthcare service that you provide, we are required now to give you a good faith estimate so that you know, so that no one is surprised by a bill. You know, I've had individuals who've come to me who needed services. And once they overcame those cultural barriers, I said to them, I'm glad you're here. And so I'll work with you as far as the payment and how much you pay and provide a sliding scale. But there have been some that I've provided services for simply free. Yes. And that's what we do because we're in the profession because we care. We still have to eat, but we're in the profession because we care. And so the good faith estimate is really important that we acknowledge that, and you expect that from individuals who are providing services. So there's no surprises. You understand what's going to happen. And so as we are sharing that good faith estimate, we're involving the individual, the family, the couple within that treatment planning of this is what to expect from A to Z.
Okay. I'd also like to add that just while some therapists may be out of network, you're not to receive reimbursement. A client, if a therapist is out of network, sometimes you can contact your employer and you can receive that. I think you can receive you can be paid for it. The services can be paid for, and then you be reimbursed. It kind of works that way with some agencies.
And for some individuals who just don't want it a part of their insurance and part of that record, they have the option to pay and, move forward.
Okay, I want to kind of switch from the business side of it to the clinician side of it for a second. I have a question in the chat, and the question is that how can they cope with panic attacks or panic disorder? That they have them every day, and what can they do in order to manage their panic episodes?
One of the things I would say, again, each individual is different. And so I would have to consider the complete context of that individual to say, okay, 1, 2, 3, this is what helps. But talking on a generalistic scale, kind of an overarching view, what can you do to help with panic attacks? I definitely would say seek someone who can help you process through what is going on, how are you feeling, when are you feeling, what are your triggers, and then to talk about coping strategies that can be helpful for the individual. For some individuals now in COVID-19, they may have panic attacks because they experience a significant loss and possibly more than one. They experience a great deal of trauma. And so now they're having anxiety, generalized anxiety. And so there are various strategies to coping and dealing with that. But we have to begin to talk about what are the triggers to then talk about what are some strategies that will be helpful for the individual.
Is that the same? Is that the same that goes for, let's say, a person is feeling down or depressed? But let me back up and ask the question. Mm-hmm. Is there a difference between a feeling of sadness, feeling blue, and a clinical depression?
Yes, there's a difference. You know, we all have emotions, we all have feelings, and there is any given day we may feel down or a little bit blue. But depression is more than just feeling down or a little bit blue. We actually use a particular criteria in a DSM, and I know people do not know what a DSM manual is, but just know that we have a standardized guideline, if you will. That's what we consider in our profession is universal to determine clinical depression or what is depression, but it's more than just feeling blue or feeling down. It's basically individuals for any marked period of time, 2 weeks plus, that have a loss of interest in the things that they normally would do. They maybe are eating more, eating less, sleeping more, sleeping less. Feelings of worthlessness are some of the feelings that the individual may have. They may feel a little bit more fatigued, have a loss of interest in doing things, and just feeling like, hey, I'm just not okay. Just feeling not okay. And for some individuals, they have reoccurring thoughts of death, of hurting or harming themselves. They have suicidal ideations, and some may even attempt suicide.
And earlier, Ms. Welton said that you need to do a self-assessment. You need to monitor your emotions, your thoughts. Look at the duration of, how long are you feeling this sadness, these low moods, these high moods. Document that information. Look at the triggers that may lead to you feeling this way, and the times that this has happened and the duration. However, there is a difference, and we're looking at the severity.
Okay.
And you get information that you can take to your therapist, your psychiatrist, gather this information.
Consider family history of prolonged sadness, the blues, and things like that, because we oftentimes disqualify clinical diagnoses by subtle words such as descriptions such as I'm feeling tired, but when mom's been feeling tired all of your life and fatigued and she's not been able to get out of the bed, she's not just tired or fatigued. It may be something generational, or genetic that may have been passed down. So consider that. Yeah.
And if I can add to that, we all have an emotional bucket. And as we go through life, that bucket begins to fill up. So you're 6 years old and your parents divorced. That's parental abandonment. It starts to fill up. And then you turn 12 and grandma passed away. It fills up again. And then you turn 18 and the person you all in love with, you done gave your heart to them, they gave their heart to you, then you break up. And now your heart's all over the place. Your bucket is filled again. And then COVID happens. And that's like a brick coming into your bucket, and your emotions are spilling out all over the place. Right? And now you're angry, you're sad, you have anxiety, you're depressed, right? And you don't understand why. That's because you never put in the proper spigots to release the emotions that's in that bucket. And just because the bucket happened when you were 6, if you're 66 and you've never put in the spigot to release it, you're still carrying that from 6 years old.
And interesting, the way we handle things individually oftentimes representative of how our family of origin handled things.
Yes.
And so for some of us, we are dealing with generational trauma for several reasons. So it's important to keep that in mind as well as you're kind of doing your self-awareness, self-assessment, is look at the full picture, the big context of who you are, as well as your family, where you came from, basically. How did you all handle issues? Did we not talk about it? Did we just say, hey, go pray about it? Did we say, hey, you're going to be all right, don't talk about it? How did we handle those issues determines how we're handling issues now. But the interesting and the good piece about it, we can always learn new behaviors of coping so that we can have an improved quality of life.
And on that coping, if you're drinking, you probably have somebody who you love who drank under stress, right? Yes. Your dad drank or your uncle drank. If you're cheating on your spouse, there's probably somebody in your family that also cheats. And so you're doing exactly what you see, and you're seeking comfort in places you have no business seeking comfort.
And the interest you brought that up, a lot of research that I did when working on my PhD was about trauma as well as infidelity and the intersectionality of those as it involves culture. But when you talk about infidelity and COVID-19 and trauma, there's an intersectionality. There was increased infidelity that occurred during COVID-19. A lot of individuals found out during COVID-19, maybe their spouse had been in extramarital affair prior to COVID and during COVID. So COVID-19 has been very impactful for all of us in so many different ways. Infidelity is one, anxiety is another. COVID-19 now, as we're beginning to see and we'll see, is a long haulers effect of COVID-19. Oftentimes, we mostly talked about the physical implication or the physical impact of COVID-19, but COVID-19 has pushed us into a mental health crisis, and that is a public health issue that we have to grapple with and we have to address. So addressing the stigmas, addressing how do we now normalize the conversation. As someone mentioned earlier, May is Mental Health Awareness Month. But we have to move away from just being in awareness to a place of action. What are we doing to move the needle? And so I tell individuals, connect with other people. Don't be afraid to share and tell your story. Now, for those who are listening, particularly younger people, you do need to sometimes make sure you're in that safe community of space that you can share, people you can trust. But be in a place that you can connect with others to share your story so that we can destigmatize mental health care services and accessing it.
And also to begin to talk in families, to talk about your family history. It's very important to know if there was someone in your family that had a mental illness, or a substance abuse issue, that, if children that have parents that have had, or ancestors that have had mental health illness, are 4 times likely to develop mental health illnesses. So let's share information and let's stop sitting in silence.
Fantastic conversation. Kids and mental health. We know that we see an increase of mental health crises in kids. Kids deal with depression differently from adults. And so what are some of the signs that parents can probably take a look at to see if their kids might be going through a crisis, might be going through some trauma? What are some signs you think parents can take a look at to see if their kids are okay?
One thing is that we want to have regular conversations with our children. We need to watch and observe our children to see if there's a change in their emotions, if they have a persistence of sadness, or they could be withdrawing. They could also be engaging in some risky behavior, running in the street, hurting themselves. And they may have actually talked about, dying by suicide. Their moods may fluctuate. They may have problems with worrying, excessive worrying, or being anxious, or having tantrums. Look at their hygiene, if that's changed. Their loss of interest, their sleeping or eating patterns may definitely change. And also their interaction with other people. Maybe they're withdrawing. So those are some things that you may want to look at. Their peer relationships. Those are some signs that may be outward signs or internal signs. But start talking to your children about their day, about their feelings.
And so on that, the 2 books that I wrote, they're currently being used in Miami-Dade public schools, as well as Hillsborough and Pinellas counties in the school district. And so that I focus on that with the youth. So instead of asking what's wrong with you, I ask what happened to you. So if we just look at the bucket and what happened to our youth, girls want to talk to their biological fathers, I found, every day. Boys want to talk to their biological fathers 3 times a week. So if daddy is calling on Christmas and birthdays, that young man or that young lady needs counseling. right? That is a sign right there that they're feeling heartbroken. If grandma passed away and grandma was their confidant, if they went to grandma to talk and she kept all of their secrets and she passed away, that child needs counseling. That child is in trouble. We just don't know when it will blow up, right? Whether they're going to blow up and yell at people and punch somebody in the face at school or start vaping or smoking and things of that nature. So we got to look at that. If they lost a best friend in a car accident, we have to know that is an immediate 911. We need to get our child therapy as soon as possible, just based on the things that's happened to them. Before you, because a lot of stuff we ain't got, the kid ain't, you're not going to know because they're sneaking, right? So if you know an event just happened, the bucket has filled up, it's time to get them in therapy as soon as possible.
I like that question. So get kids in therapy as soon as you detect something even possible that might be going on with them. Have you ever addressed or worked with children that might be suicidal? And if so, what are some of the signs that parents may look for?
I've worked with individuals, children, adults who have been suicidal. And some of the things that, I look for, actually, I have a checklist, a standardized format of asking questions. And it's okay to ask the questions, or you think about hurting or harming yourself. And I'm not afraid to ask that question. It is an important question to ask. And from there, some individuals will honestly tell you and be transparent. Yes, I've thought about it. But I also ask, not only have you thought about it, do you have a plan? And I know individuals get really cringy by hearing me say that. Why ask that? That's putting a thought in their heads. No, it's not.
It's not.
Individuals who were thinking about suicide, having suicide ideations, they were thinking about it if they were before I asked the question. But asking them if they have a plan helps me kind of determine where they are with those suicidal ideations and what kind of help do we need immediately, or what kind of help do we need to plan for in the next day, the upcoming days and weeks and months and even years. And so a few things that I look for: asking a question, do they have a plan? But you ask about their behavior. Have they been giving away things? Have they been talking about suicide? A lot of individuals may be experiencing depression as well. So I look for the signs and some of the things that we talked about earlier in reference to depression.
Okay, fantastic.
We also want to look at the means of if they have a plan, looking at some things that they maybe have access to, and to remove those items and secure those items.
Yeah, remove the guns, remove the knives, remove the medication that grandma keeps in the top of her drawers, things of that nature. All right, I want to move into a section that I hear that I see in the chat, and it's about relationships, couples, and marriages. At what point where should a person in a relationship or in their marriage should seek some type of therapy or counseling if they feel that the marriage is going down the wrong road, or there has been some detection of distance from their spouse or partner? What is the telltale sign that maybe my marriage or relationship might be in trouble?
Well, if I can jump in really quick on that one, we all carry that bucket. And before we say I do, we need to empty our bucket, right? And counseling is one of those spigots that empties the bucket. And so if she enters or the one partner empties their bucket, the other partner empties their bucket, now they can individually, they can seek marital counseling to learn how to function well together. And so if you start to sliding away, I've been married 28 years. If you start to sliding away, and you do slide over 28 years, trust me, the way to come back is to, again, start that individual thing. Let's deal with our stuff, and then let's come together and get that marital counseling.
I think that to kind of parrot what he's saying, at that point, you recognize that this is beyond what I can handle. Mm-hmm. And once you have that level of insight, and you begin to realize that this is beyond something that I can handle, you should always seek out professional help. We seek out professional help when we break our legs, when we have serious injuries. So we should seek out professional help when whatever is occurring is beyond insightfully what we can handle.
Fantastic. I like that. Seeking out professional help. And that's even after you go to the pastor. And even if the pastor can't help you, the pastor should be referring you to some type of therapist so you can seek some professional help. I always say this when people come in. I say, God is the source, but mental health counselors, marriage and family therapists, licensed clinical social work, and all professional counselors are resources from God.
Yes.
Amen.
Yes.
Amen.
Okay. We are really at our close now. We're closing down. I want to go around the table and have one final word or any messages that you want to tell our listening audience. And I will start with Dr. Deidre Sandra Burnett.
I would encourage our audience to keep talking about mental health, to seek out help for yourself as well as your loved one, and to share the information that you received today.
Thank you. Rod Cunningham.
I like to give those 5 spigots that I talk about that's in the bucket to release the bucket. I mentioned that therapy is one of them. Journaling or art is another. Finding purpose in your life. And purpose has nothing to do with you and everything to do with why somebody else's life better because you lived. As Dr. Smith talked about spirituality, the importance of connecting, to God, outside of religion, but you connecting to God and understanding that you and God can do this together. And then the last one is forgiveness. Forgiving everyone that's ever hurt you in your entire life. The person that fired you, the person that left you, the person that died on you, the person that hurt you, all of those people, you have to forgive them so that you can release it. Because if you hold on to it, you remain the victim. Whether that person is dead or going on with their life, you're still a victim to them. And so I would take those 5 areas and I would surround them with unconditional love. So we have to love each other unconditionally. Those are surrounded there. And then the last thing is it's a daily walk. So that self-care, taking a walk, putting on your music, going swimming, doing yoga, doing sit-ups and push-ups, something to raise your frequency every day before you step out into this world.
Stephanie Wellings.
Well, I just like to speak to the urgency and the need for support for our children, and even those grandparents who are now operating as parents to children who have absent parents as a result of this opioid crisis of neglect and abuse due to grief, loss, failed attachments, no attachments, disorganized attachments, stressful attachments. So I just would like for us to become more knowledgeable of what is going on in our communities and our nation, how it is affecting our children, and for us to be able to create avenues, forums as such to advocate for their mental wellness.
Thank you. Dr. Smith.
You're on mute.
You're on mute, Dr. Smith.
Again, I want to say thank you for the opportunity to be here. One of the lasting words I would share with everyone is that, we have all experienced, again, individual, collectively, grief or trauma, and that the stages of grief are being in shock, denial, go through pain, anger, possibly depression. Those are some of the normal steps. But I hope and want to encourage everyone to seek the necessary help and support that they need so they can move through the reconstruction phase and working through their grief, so they can move to a place of acceptance, of hope, of living again and improving their quality of life and setting new goals and acting and walking through that phase of life that is peaceful and that is good, a good place for them. I want to encourage everyone that as you embrace your mental health, and embrace what you've gone through, the grief or the trauma, it doesn't mean you're giving up. It doesn't mean you even agree with the trauma, the things that happened. It doesn't mean that at all. It doesn't mean that, again, you are giving up, surrendering, or you're just tolerating, or you failed, because you did not fail. But accepting and embracing your mental health simply means you're opening yourself up for new beginnings. You're allowing newness. You're leaning in, breathing in, expanding, and you're just willing to release that struggle, that thing that holds you back. And I hope that individuals will experience what we call post-traumatic growth. I want you to experience the growth after the trauma, after the grief, and that know that we can work through the grief and the pain, and we can live and thrive through it and without it. And so I encourage everyone to just embrace your mental health and where you are on the continuum, do the self-monitoring, but monitor those who are around you as well. We are in a community, and so we should be accountable to each other to say, hey, I think you may need some support, or just ask, are you okay today? And be okay with them giving you the answer that they just have to give, and spend the time with them, but also sharing resources with individuals so that they can get the necessary help that they need. But thank you again for the opportunity to be here.
Thank you.
Thank you. And I also want to mention to someone out there in the audience is that if you are feeling not like yourself, if you think that you might be in trouble, if you think, or if you know someone that might be thinking about harming themselves or hurting themselves or hurting some others, there is a national hotline, the National Suicide Prevention Hotline. Is a hotline and an organization that is dedicated to answering calls to refer you to the proper mental health provider. And that number is 1-800-273-8255. 1-800-273-8255. And again, I'll call 911 at your local area, and you can receive some help or some assistance in getting the proper help that you may need. Again, it's been a wealth of knowledge. I've learned some things. I've grown some things. I think now I can go out there and start doing some therapy myself. I think I've been rebirthed. I want to thank the following sponsors for putting on the mental health webinar for adults and our youth. I want to thank Global Health Community Service, the Florida statewide organization of Omega Psi Phi, Quantum Foundation, the TED Center, Healthier Barnum Beach, non-for-profit First Truist, Alpha Upsilon Omega chapter, and the Epsilon Gamma chapter, Alpha Kappa Alpha Sorority Incorporated. And I also want to give a shout out to KOP Mentoring and Networking for producing this program. Some particular individuals, Neil and C. Ron Allen, thank you guys for putting in the hard work and making this production be possible. And last thing I want to say is that there is no good health without mental health.
Yes.
There is no physical health without mental health, and there's no spiritual health without mental health. Always preserve your mental health. Your mental health is the key for success in life. Thank you, panelists, for being on the chat here, and hopefully we'll get a chance to do maybe a part B, a part 2 on this. Thank you very much.
Dr. Hines, if anyone not sure if they need therapy, just ask the person close to them. They'll tell them.
They will point the direction. Go there. All right, guys. Thank you. I really appreciate it.
Thank you. Thank you for having us.
Thank you. Okay.
Bye.
Bye-bye.